Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Colibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Hello, and thank you for joining us for another podcast episode. I'm Jonna A. Meal. I'm the head of learning here at Colibri Healthcare. And joining me, a very special guest, Dr. Stephanie Bonney. And Dr. Stephanie Bonney, you are the chief trauma surgeon, right, at Hackensack? Is that correct?
Yes, that's correct.
Yeah. Okay, but they have a whole list of other things that you do as well. You are a member of the Association of Surgery Trauma. You lead a leadership position there, is that right? On the Injury Prevention Committee, advisory board member of Firearm. We'll talk a little bit about what Firearm is, but that's the American Foundation of Firearm Injury Reduction in Medicine. And a council member of the Association of Women Surgeons and member of the Eastern Association for the Trauma of Surgery. So basically, you don't do very much. This is what all of this is.
Yeah, it's pretty busy.
You have a lot going on. Tell us a little bit about these. Yeah, talk to us about this. I would love to hear a little bit more about yourself here and your involvement in trauma and Affirm on these committees and really how it's going to lead to our conversation here about firearm violence.
Yeah, so I'm, a trauma surgeon by training. So I work in a trauma center where I see patients who are injured by all different types of ways, whether it's falls or car crashes or firearm injury or anything else. I'm also an ICU doctor, so I take care of patients in the surgical ICU. And I have a leadership role in my trauma center where I'm also leading the entire group of trauma surgeons and all of our physician extenders and various colleagues in nursing and quality to manage the level 1 trauma center in Hackensack. The part of it from the other organizations is really something that I do in addition to my clinical job. So I'm very interested in the physicians associations and the professional groups that are moving our field along. So doing good science to help us treat patients better, helping us to better understand some of the public health issues around trauma, and helping to address some of these public health problems like gun violence or like motor vehicle injury and falls and all of these other types of injuries that we see. So my role in all of these organizations has been to lead various committees and other groups and organizations that are working on some of these issues. So I am part of the American Association for the Surgery of Trauma. I'm the vice chair of their Injury Prevention Committee. So that's a group of injury prevention professionals and physicians across the board who are interested in providing information about injury prevention, providing guidelines to physicians about how to screen for various types of risk factors for injury, and who work together to provide materials to our colleagues, so like presentations or guidelines that help other surgeons understand these problems better and work on them in their practices. So that's all part of what I do with all of the organizational work. And most of that is very similar in many of the other organizations. I was involved in Affirm for a while, and they have sort of blown up and expanded into this very large organization that's involved with the Aspen Institute. But a few years ago, even just before COVID, a bunch of the surgeons and professionals from all different areas of medicine came together in Chicago and had really big meeting to say like, hey, what are we doing as physicians and what can we be doing better? And Affirm was really at the very beginning of this movement of physicians that are very interested in addressing the problem of gun violence in our country.
Yeah, that's really fascinating. And one of the things that's top of mind, and I'm going to bet that you get this question in a lot of different ways, is how does a physician get involved in firearm violence, right? And even in a way that you spoke about it as a public health issue, as it is, right? We think about like community and public outside of this hospital type of healthcare setting that, all the healthcare professionals live in that box, but don't maybe touch what's really happening in the real world, if you will. So I'm curious, how did you get involved in this particular space?
So I think many physicians have similar stories. My story, my personal story is that, I was interested in trauma and injury and critical care and went to medical school and did a surgery residency and wasn't sure I was going to be a trauma surgeon. But I had seen a lot of that and was very interested in it. And even as a resident, when I was in training, I had, sometimes to go and speak with families and tell them that their child or their loved one had died. And I remember thinking that this is so preventable. These problems that, oftentimes, particularly with firearm violence, but also with other types of injuries, it's always such a shock because typically that person was well and going about having a normal day and something terrible happened to them and now they're dead and it's very unexpected. And it was hard to tell families that. But I remember the first time after I became a parent that I had to go tell another parent that their child was dead. And it had a profound effect on me. And I was like, I just can't continue to stand by and do this without addressing it. And we have a voice in this problem because we see it. It comes to us. It comes into our house, into our hospital, and comes to our door. And we can't just ignore that we're seeing all of these injuries and say that there's nothing that can be done about it. There are things that can be done. And so I learned a lot about the different approaches to this problem. And there are different approaches. There are approaches that are very much based in policy. There are other approaches that are very much based in violence prevention globally. There's gun violence isn't the only kind of violence that we see. And then there are all of these other approaches that involve public health, safety, making gun ownership as safe as possible in our society. So that's what I became sort of interested in learning about. And there's been a big groundswell of physicians who are having these discussions in our various organizations because I think in some sense, it's just exasperation. Like we're just exhausted from seeing this very preventable problem over and over again.
Yeah, that's a really good point. So speaking of the problem, right, because we bring up the problem, that's a good segue into what exactly is the problem, right? So we're talking about firearm violence in this way, but I'm curious what the prevalence is. Like, what do the stats say? What's the data say? And I'm going to kind of segue into timely things, right? And that in the same vein. But I'm curious, like when we talk about this, what is really the reality of firearm violence in the United States?
Sure. So there's some pretty basic statistics, and I'll actually also give some comparison statistics. So
Great.
There's about 40,000 people that die by firearm every year in the United States. And for comparison, it's just about the same number who die in motor vehicle collisions. Wow. And actually, we surpassed that line crossed a couple of years ago. And so now there's actually probably a few hundred to maybe a few thousand more people that die by firearm every year than die in motor vehicle collisions, because motor vehicle collisions continues to go down as we develop safer roadways and safer cars.
Interesting.
other thing that happened that's really demoralizing to my profession in the past year is that firearm injury is now the number one cause of death of children in the United States. So it used to be just injury in general. Like lots of kids have, car crashes, they fall, they, have other issues and, die from these really tragic circumstances. But now firearm injury has surpassed as the number one cause of death over all other types of injury, which means that is the single biggest risk to our children's lives. And so that's another statistic that's pretty sobering. But I think where I sort of became interested on the research side in this problem is that we actually don't have any idea really how many people in the United States every year are shot and survive. So it's very easy to count the deaths because we have death records and vital statistics, but there's no really good public health system that is completely accurate in figuring out how many people are shot and survive. And there's a lot of reasons for that. People go to various types of hospitals. Not all hospitals report into the same data systems. People may not go to the hospital at all. Some people die before they get to the hospital. So they're in the vital statistics systems, but they're not in the hospital records. Other people die in the hospital. So there's overlap between those records and vital statistics. And many of those of us who work in public health and who have access to hospital data have been trying to figure out that number and have really been trying to understand better how many people are shot and survive every year, and also what is the makeup of those people. What are their demographics? Is this men? Is it women? Is it children? Is it is the racial makeup, the geographic makeup? Is it more common in places that have different types of firearm laws? And what does that mean for us, moving forward? And how does that inform us as a society about how we prevent this problem? And so that has been a big focus of my research, has been really on the epidemiology of this problem, because we don't understand it as well as we need to in order to make meaningful prevention strategies.
Yeah. And it seems like, when I think about firearm violence, and we should touch on this point too, as well, right? We're kind of being purposeful in the way that we're saying this in firearm violence. And I've seen different terminology too that kind of floats around, and we hear all sorts of things in the media and the paper, and it's gun violence and gun control or firearm this or assault this or this and that. But I'm curious, even one piece is the language, like landing on what the language is that we're talking about, because to your point, we have a lot of data on deaths, but not a lot of data on just injuries, alone. And I'm wondering, kind of two-part, how we got to this new bit of language, where that stemmed from. And the other thing I want to talk about is how that demographic is changing. You touched a little bit about children. We'll talk about that, but really it's changing the setting, right? Now we're seeing it too in the hospitals. We just had a Dallas incident that happened in clinics, right? We continue to see it in schools in this way. But let's start with the first piece. The language around talking about firearm violence versus gun control. What's that about? What, in your opinion, why is it important that we use really pointed language and be really, really clear about what it is that we're saying?
Yeah. So I prefer the term firearm injury. Guns to me sounds a little more. I think there's a connotation to it that's just a little bit different. And some people really want to use that connotation to get their point across. I think the terminology that we've settled on in sort of academic, like we're looking at this problem trying to look at it from a very objective lens. I think that has landed us on firearm injury. and firearm injury prevention. I mean, that's really what we're trying to do. I think, when we bring violence into it, there's also a connotation of a person perpetrating an act of violence onto another person. That is not to say that, suicide or other things are not violent acts. They are. But I think that when we talk about violence, our minds tend to go toward this sort of like urban, scene. And that's really not accurate. Much of the firearm violence in the United States is happening in the suburbs and it's happening in rural areas. And then when we use the term violence, it also discounts unintentional injury or, accidents. I don't like the term accident because it implies that something's non-preventable. And I think all of these problems are preventable. So I prefer unintentional injury. And that, is also a huge problem. And that's a lot of what's happening to our children is, finding firearms around the home and, the accidental or unintentional discharge of a firearm either upon themselves or upon another child or another adult. And that's a big problem too. So I think firearm injury really encompasses everything. I really hate the term gun control. I don't think any of this is about trying to control people's weapons. We have a constitutional right to carry a firearm in this country. I think that it's really about changing the narrative to bring that right marry it with responsibility and say that, this is a right that comes with a responsibility. And what we need to do is use these public health principles, this multidisciplinary science of public health to make that firearm ownership as safe as possible. And that does mean things like safe storage of firearms and being mindful about child access prevention. Children should not have access to weapons. Being mindful about people who are maybe unstable or older folks who've developed dementia and making sure that those folks don't have access to weapons, because these are some of the bigger problems that we're seeing in our society.
Yeah, that's a really good point too. So, well, the demographics right now, I feel like if we were to ask just random people, where do you feel like firearm violence is the most prevalent? We would get all sorts of different answers, like maybe in this group, maybe in this city, maybe in this area. But right now, like what are the primary or the largest risk? Maybe risk is not even the word because everyone's a risk, right? But really the largest population that's affected by firearm violence today. And are we taking into account the different settings that we're seeing that happen?
Yeah.
So who's most affected right now?
So when I think about who's most affected by firearm violence, I put this into 4 buckets.
Okay.
The first is children, which we've already talked about.
Yeah.
The second is women. And women often come into contact with a firearm injury or firearm violence in the setting of a intimate partner violence situation. So, one sort of shocking statistic is that if you take 2 homes in the United States where there's some sort of domestic violence that's regularly happening, and you put a gun in one of those homes, the woman is 500% more likely to die, 5 times more likely to die than in a home without a firearm. So women are definitely at higher risk. The intimate partner murder rate in the United States is much higher than anywhere else in the developed world. And much of that has to do with just the lethality of means and the ease of access of firearms. So that's the second sort of at-risk group. The third at-risk group is the young African-American, primarily male population that's urban. This is urban violence that's happening in our cities, is largely related to social determinants of health, like like access to safe housing, access to food, access to education opportunity, jobs. This is really very much a social problem that manifests as firearm violence, but really has its roots in the way that we're supporting and investing in our communities, particularly communities that have been traditionally marginalized, like communities of color. And then the last bucket I think of is those with mental and psychiatric illness. So that comes in two forms. One is that, is the obvious one, which is suicide. People who have psychiatric problems tend to die by suicide more. And then again, that lethality of means and having the firearm available. And that actually is quite the opposite of the young Black male problem. It's really a old Caucasian male problem. So this is primarily affects rural and suburban older white men. They're the primary demographic for suicide by firearm. But then I also want to just say that there's also this trope that, those who have psychiatric problems or mental illness are likely to become the perpetrators of gun violence. And so we need to invest in our mental health system. We do need to invest in our mental health system for a lot of reasons, but it's not because those with, psychiatric illness are going to go into the schools and whatever. That does happen. But on a population level, those who have mental illness are far more likely to become the victims of gun violence than they are to ever become a perpetrator. And then there is this very small percentage that gets, highly sensationalized of schools and public places and grocery stores and now hospitals where those problems manifest themselves. But it is important to note that sort of mass shooting that gets put onto the news is actually a very small percentage, like single digit percentages of the total gun violence that's experienced in the United States every year.
Yeah. And I think that's a really important point because we see it all the time. And I want to be sensitive to the fact that yes, this is true and it's happening. And unfortunately, we know it's happening and we're seeing it happen in these different public places like schools and like churches and like hospitals. And one of the things that I think about, one, as a nurse myself, but two, just as a person, just a human, being human with other humans, is that when we kind of create this alarm, if you will, right, for the things that we see with the mass shootings that happen in public places like schools, churches, hospitals in that way. And it oftentimes feels like a lot of the resources, a lot of the light is shined in that way and saying we need to look at this and fix this and solution for this. But on the other end, I think about the firearm violence that happens every single minute, every single day, in a whole lot of communities that I'm from, that don't seem to quite get all of that light that shined, in that way. And this is an ongoing problem forever and ever that does play a role into, kind of where we see it float to the top in the news. And I'm curious about that because it shifts demographics for sure, right? Because we're talking about one very specific setting. We're talking about schools, we're talking about hospitals versus in the community. And I'm curious how physicians, how pharmacists, how any, these different allied fields, how nurses can also help to advocate and push the conversations about research and about funding and about, the ways that we can support outside of our own fields. And just wanted to kind of get your opinion on that. From your perspective, how do you think that we can help really in the public space outside of, what we know is just major demographics that are being affected in our own profession?
So I think that there is a lot that we can do to, number one, just tell the stories of the people. Yeah. This becomes a faceless problem because it becomes numbers. It becomes 40,000 and,
Good point.
And 10,000 of this and 20,000 of that. And it really depersonalizes the problem. And I think that we need to tell the stories of the people that we are seeing in our professional lives that are being affected by this. And that is valuable and important. And our lived experience as healthcare professionals is incredibly valuable to this conversation. Not only in the sort of, very sensationalized way of like, oh my gosh, I just got blood all up and down me and it's all over my shoes and I gave somebody 50 units of blood. And then I had to go tell their family that they died and mom was screaming. And, those are really common narratives. We do that almost every day in our line of work. But there's also, the person who had, a firearm injury where they got shot across some fat, and really came to the hospital, didn't have any injuries. It's went across their arm or across their leg. And they essentially didn't need any intervention from the hospital. Sometimes we just put Band-Aids on these wounds and send people back out of the hospital. But now that person doesn't feel safe in their community. They don't feel safe in their home. They're waking up at night with PTSD. And in medicine, we're seeing these patients too. The patients that just can't seem to find a space where they feel safe and healthy again. And number one, providing the types of resources and support through things like trauma survivorship clinics, mental health support and trauma recovery programs, and also violence intervention programs where we partner with community groups to prevent violence in the communities, both in the hospital and through community organizations, using this public health approach, engaging our communities in the conversation. So the conversation is going to look very different if you're a nurse or a healthcare professional working in maybe a smaller rural hospital than it is if you're working in, a big or a small urban center. Maybe in that smaller hospital, it's about talking to those sort of people who utilize the emergency room frequently about, hey, do you have a firearm in your home? How do you store it? Is it locked up? How do you feel safe there? Or, the children that are now thinking about what they're going to do with mom as she gets advanced dementia and saying, hey, just so you know, like if you have a gun in the house and mom's going to be staying alone, you might want to think about getting that out of there. That's the kind of conversations you can have in those places. And then, in urban places, it might look differently. It might look more like violence prevention. It might look more like getting the faith leaders in the community and the leaders of community organizations and various community initiatives together into a forum to talk about this problem and talk about what they're doing in their neighborhoods and with their neighbors and with their churches and with their schools to address the problem of, safety in those neighborhoods. And so that may look like something very different in those kinds of places. But I think we as healthcare providers, because we care for everybody, really have a unique opportunity to highlight this problem and say, hey, look at what's happening here. And here's how we can help be part of the solution. Let's get this together. Let's use the hospital conference room for a community meeting. Let's, do these kinds of things. So I think that you don't have to be a doctor to do that. You can do that, in any of the health professions. So these are some of the ideas and some of the ways that I've seen colleagues and others throughout the healthcare profession work on this problem. And also, this is a lot of what the professional organizations are trying to do to support people who want to build these types of relationships and programs in their own communities and their own hospitals and their own medical centers.
Yeah. And I love that, we're all getting involved in this way. All of us, in healthcare, whatever discipline that we are, really getting involved in this way and supporting what we know is happening and trying to change that narrative and really provide some solutions, or at least push for solutions. And one of the things you touched on it earlier too, you're doing a great job, and healthcare providers are doing a great job really trying to uplift this issue. We're going to take a break and conclude episode 1. We talked about a lot today, from what firearm injury looks like, gaps in research, and who may be at higher risk for injury related to firearms. Please join us again for episode 2, where we're going to discuss funding for research and multidisciplinary and interprofessional approaches for addressing the significant and serious issue of firearm injury in the United States.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.